Yes, greetings to you. Hopefully you're doing very, very well. I want to welcome you to Home-Based Medical Services Television. That is HBMS TV Talking Health. Today's topic is something that is very, very exciting. Remember, every Tuesday evening, we always have a topical discussion or sharing where we talk about health. And this topic of very discussion is repeated every Friday evening. That is around 10 p.m. And today's discussion, or the discussion we had on Tuesday, was about hypertension. And I want to bring it to your notice. Oh, it's just a question. But did you know that traveling boosts your immune system and plays an important role in preventing and reversing cardiovascular diseases like hypertension, the topic that we discussed there. And I also want to send a vote of thanks to our sponsors, for example, Tours and Travel Consultancy. And for details, the numbers are down there. You can always reach out to them so that you can be able to travel with them. Then the other thing is, for those of you who are part of the iGrow family, we also have a trip in Dubai. That is January. You just need to know what is required. Make sure that you travel with us. So we are going to be discussing about high blood pressure. And most of you have seen these figures either in your medical forms or the medical forms of your relatives. And we look at ranges in millimeters of mercury, where we talk about 120 to 129, and then anything to do with the greater than 80, that is already elevated blood pressure. Then you can talk about 130 to 139, 80 to 89, and that is stage 1 hypertension. Then 140 plus and 90 plus, that is stage 2 hypertension. That is about high blood pressure. Yes, we are going to expound more about that, but the very topic that we have is hypertension or high blood pressure. These are some of the things that you need to know. But again, I also want to send a vote of thanks to our other sponsor, that is Mitiana Institute of Nursing and Midwifery. Thank you very much for sponsoring us. But I want to bring it to your notice that there are facts that you need to know about hypertension. And these are some of them. That having hypertension puts you at risk for heart diseases and stroke, which are among the leading cause of death worldwide. Very many people are dying or succumbing to death simply because of those two diseases or conditions, heart diseases and then stroke. And surprisingly, only about 1 in 4 adults, that is 25% with hypertension, have their condition under control. Can you imagine? People are out there, but their high blood pressure is not in control. These are some of the figures that you need to understand, where you have the normal, then normal but requires control measures, then high and very high. I talked about that earlier. And then you also need to talk about the pulse rate, the rate at which your heart beats. In adults, there are ranges, that is if you're normal. Then also in children, there are also ranges, that is if they are normal. Then the other thing that I want to discuss are the temperature ranges. I want to bring it to your notice that temperature is a very, very important factor while you're dealing with health. So you must be able to know what is normal and what is abnormal. Very many victims are out there and they're facing conditions of hypothermia, or at times hyperthermia, which almost kills people because it results into multi-organ failure. Then we'll talk about respiration, the rate at which somebody breathes in and out. You must know the normal and the abnormal. But today's topic, or the topic we had on Tuesday, we talked about water and the body. And we all know, it is known to everyone that water is important, but never knew about the special times one has to drink it. Everyone knows water is good, but you don't know the time you're supposed to take it. For example, drinking 1 glass of water at the right time maximizes its effectiveness on the human body. You get the point? Almost 60% of our blood is almost water. So you get the point, and then the rest are the cells. So 1 glass of water after waking up helps to activate your internal organs. Then the other one, 30 minutes before a meal helps in proper digestion. Then before taking a bath helps lower your blood pressure. Then before going to bed, avoid stroke or heart attack. And I want to bring it to your notice that if you're always following us at HBMS TV, you've even subscribed on our YouTube channel, you see us on the social media platforms, always share the information that we share with you. That is your motto. You must do it because you need to help someone out there. Now, allow me to talk about the health benefits of water to the body. I want to let you know that drinking water helps maintain the balance of the body fluids. Your body is composed about 80% of water. Then water can help control calories in your body. Then water helps energize your muscles. Water helps keep the skin looking good. Then water helps your kidneys. Then it also helps maintain normal bowel function. That is water and the body. So there are very, very many health benefits: hydrating and nourishing, promoting health skin. I talked about that, preventing kidney stones, then boosting brain health, then preventing headache, flushes out waste, supports digestion, aids body function, boosts the immune system, and then aids immunity. You get the point, eh? So when we get back to hypertension, somebody would ask, what is high blood pressure? So high blood pressure is when the force of blood pushing against your arterial walls is consistently too high. Don't go to a clinic and then one test, they tell you start antihypertensives. But as long as it is consistently high, this damages your arteries over time. You get the point, eh? And can lead to serious complications like heart attack and stroke. I earlier talked about that. And surprisingly, it is a silent killer because you usually don't have any symptoms. Blood pressure is the measurement of the pressure or the force of blood pushing against what? The blood walls. You get the point, eh? So that is high blood pressure. We always have the systolic number, that is when your heart has contracted. Then you also have the diastolic, that is when the heart is at rest, force of blood on the arteries. You get the point, eh? That is how we measure it. And when we talk about causes of high blood pressure has no symptoms and can be dangerous if not treated. So I want to bring you notice that hypertension puts you at risk of stroke, heart attack, and other problems. And nearly half of adults who have hypertension do not realize it. So routine checkup is always very, very what? Very vital for you. So when we start talking about the causes of hypertension, there are a forest of causes, but I'll mention that if you like a lot of alcohol, if you're that one person who is addicted, you're in problems. Then when you talk about obesity, excessive salt intake, sleep apnea, smoking, kidney disease, sedentary life, diabetes, aging, stress, just like I've always told you, diseases don't read books. When you talk about having a sedentary lifestyle, not enough sleep, very many, Cushing syndrome, the combined oral contraceptive pill, the congenital heart disease, pregnancy. I want to let you know that there is even pregnancy-induced what? Hypertension. So all those things, even including toxins that come and occlude your blood vessels, you get a point. Then when the point of treatment comes in, that is what we do focus on. And how do you know that you have hypertension or high blood pressure? It's just by chance. You go, you have some of these signs and symptoms, and all of a sudden they are going to check you routinely, and they find out that you consistently have high what? High blood pressure. So it is by chance, but these are some of them: severe headaches all the time, fatigue, vision problems, chest pain, difficulty in breathing, irregular heartbeats, blood in urine, pounding in the chest, neck and ears, even persistent what? Palpitation. And surprisingly, there are also some risk factors that you know that when I keep on doing this and this and this, it is putting me at risk of what? Hypertension. For example, smoking. Smoking is something that you need to take serious. Then talk about lack of physical activity, overweight or obesity, too much salt consumption, then too much alcohol consumption. And you can talk about stress. You all saw that traveling relieves the stress. Then older age, then genetics, then family history of high blood pressure, chronic diseases, then talk about adrenal and thyroid disorders. And some of the complications of high blood pressure, if high blood pressure is not treated, you're going to have challenges like the coronary artery disease. You're going to find yourself having a stroke. Then talk about heart attack. peripheral artery disease, kidney disease, and kidney failure, complications during pregnancy, eye damage, vascular dementia, all those. And then we want to bring it to your notice, because this is our role as HBMS TV, lifestyle changes to lower your blood pressure. You may be wondering if you can lower your blood pressure naturally. Yes, in some cases it is very, very possible. And here are some of the proven ways to lower your blood pressure naturally. For example, keep a weight that is healthy for you. So your health provider can advise accordingly. We even have weight loss products that can help you. Burn Slim is there, Live and Burn Coffee, Colladeuse, then Angel E, talk about collagen. All those are powerful products that can help you, but you need to talk to the person who gave you this link, and they will advise you accordingly. Then eat a healthy diet. An example of the DASH diet. This is the way of eating that is full of fruits, vegetables, whole grains, and low-fatty diet. Then the other one is cut down on salt. Ideally, limit your sodium intake to not more than 1,500 milligrams per day. Then the other one, you get enough potassium. Try to consume 3,500 to 5,000 milligrams per day, ideally through the foods that you eat, and prevent supplements. Here, I want to talk about C24/7 and some foods high in potassium. They include bananas, talk about avocados, talk about potatoes. Then the other point is you do exercises. Ask your health care provider for tips to get started. In general, start slow and work your way up to 150 minutes. That is, if you can, 1 hour and 30 minutes, 2 hours, 1 hour, 2 hours, 2.5 hours, if you can, and that is if you have time, if you can run away from work and all that. Then the other one, you need to limit alcohol. If you choose to drink beverages containing alcohol, do so in moderation. Then the other one is sometimes providers recommend lifestyle changes alongside with other medications to lower your blood pressure. However, I want to let you know that hospitals give antihypertensive drugs and other medications that I would recommend before using them. Seek for medical advice. You're going to find the angiotensin converting enzyme, the inhibitors, the blockers, the diuretics. There are very many drugs that you can use. However, using them, you need to seek medical attention. Don't go and buy them. Now, we want to talk about prevention of hypertension using our natural products. There is Colladeuse, C24/7 or complete. Then the Live alkaline coffee at bedtime. The bit about this coffee, it is decaffeinated. It does not have the caffeine in it to get the point, and very many people are using it. So the dosage is just like I've shared with you. Then the other one, we have what we call reversal of hypertension in addition to treatment one is on. If you're already on treatment, bring in Colladeuse, then C24/7 and complete. Then you can also add on the Live alkaline coffee, but the duration goes longer. You get the point, And now the other beautiful thing is, if you've been a victim, Vidamax is also there for you to use. And there are always people who would want to ask, should I check my blood pressure at home? Yes, you can check your blood pressure regularly with a home blood pressure monitor, as there are automated electronic monitors you can purchase. And you always need to seek medical attention from hospitals, whether to withdraw from antihypertensive drugs. Don't be out there and then say, me, I'm doing away with these drugs. It is the work of the health practitioners. And I want to say thank you to our sponsor, that is Mikiana Institute of Nursing and Midwifery. We are home-based medical services television, that is HBMS TV Talking Health. You can always subscribe to our channel, check out our online platforms, and learn something. And as I come to the end, I also want to give credit to our other partner, that is Tours and Travel Consultants. The contacts are there. You can always reach out to them. It is at Shelwood Galmitiana Highway. And they always say, travel with us for health reasons and medical tourism. But I want to leave this quote with you, that studies have shown that taking time away from the job and everyday stress can have physical and mental health benefits, a lot of them. And vacations are linked to lower stress, and less risky of heart diseases. So go and travel with these guys here. They even have a trip that is called Mikiana to Lamblay Expo that is going to happen on the 24th 25th and 26th of October. This next month, that is in October. Reach out to them for details and travel with them to kill that stress. I want to thank you very much for following. Yes, thank you very much for being part of this wonderful session. And I want to say, may God bless you. Stay blessed. Home-based medical services television.